Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. I am your host, Joy Bofenda, and on this episode, we discuss breastfeeding alongside Professor Anthony Wanyoro of the Kenyatta University Wellness Center. But before we dive in, take a look at the health updates. Very informative health updates right there. And like we said, we are discussing breastfeeding alongside Professor Wanyoro. Professor, kindly introduce yourself to our audience again.
Thank you. My name is Professor Anthony Wanyoro, an obstetrician gynecologist and an associate professor of obstetrics at Kenyatta University.
Okay, so the topic is breastfeeding. What is breastfeeding?
Wow. Yes, breastfeeding basically has been defined as a process of giving or feeding a baby with the mother's breast milk. It could be through the baby breastfeeding or being put on the breast and suckling the milk out, or the mother could express the milk and give the baby with other means like a cup and a spoon.
Okay. Is the quality of expressed milk different from that which is straight from the breast?
No, the quality is the same because the milk basically is the same. It's only the process of moving the milk from the breast that is different.
Okay. So once a child is born, how soon should they start breastfeeding?
The ideal is as soon as the baby leaves the mother's womb, the baby should be put on breast unless there is something that will prohibit the baby being put on the breast immediately.
Even for C-section patients?
Of course, now I said unless there is something that will prohibit or will impede the breastfeeding. Currently, when you look at the cesarean section, majority of mothers are being done cesarean section through regional anesthesia or spinal anesthesia, or halfway for the common mwananchi. So the mother is still awake and breathing on her own, talking with the anesthetist. So there is no reason why that baby should not be put on the breast in a mother who is undergoing cesarean section under spinal anesthesia. The only problem now comes when the mother is under general anesthesia, because basically this mother is not able to breathe on herself, she's not conscious, so she cannot breastfeed the baby immediately.
Okay. And is it possible for a mother to completely lack breast milk even after delivery?
It is very, very rare. You find that we say that breastfeeding is possible, and it depends on practice, then persistence of breastfeeding. So practicing breastfeeding, being patient in breastfeeding, and then being persisting in breastfeeding will always give a mother ability to breastfeed. However, of course, there are few mothers, very, very few, that may have some abnormalities, like if they have problems with hormonal production, they have problems with the pituitary gland, or they have problems with their breast, they are not responding properly to the hormones, then these mothers may have a problem with breastfeeding.
Okay, you've also mentioned the impact of hormones. How important is skin-to-skin contact in stimulation of breast milk?
Yes, skin to skin, and that is why we say there is a golden hour for breastfeeding. And this golden hour is the first hour after a baby is born. And this is the hour that we talk about the mother having skin to skin contact with the baby. When this is done, you find that of course, it is beneficial to the mother because the mother is able to bond properly with the baby, and then the baby is also able to or to start the breastfeeding processes, and you find that the baby is able to breastfeed faster when the baby is put on the mother's skin immediately after delivery.
Other than bonding, what are some of the other benefits that breastfeeding gives the mother?
Well, there are many benefits, and we have immediate benefits to the mother, and we have, of course, a delayed benefit to the mother. The immediate benefit, other than what we have said, boarding, of course, breastfeeding will allow the production, one of the hormones that is produced during breastfeeding, that allows the milk to come out of the breast itself is called oxytocin. So oxytocin is a very important hormone. In one, it helps the uterus also to contract. So that when that uterus contracts, it reduces the risk of mothers getting bleeding after delivery, called postpartum bleeding, which is one of the killers of mothers. Of course, immediate benefit to the mother is also the issue of the mother not getting periods or not ovulating. So within the first 6 months after delivery, if a mother is exclusively breastfeeding and she has not had her first menses, then that can be used as a very safe contraceptive way called lactational amenorrhea method. Of course, mothers also increase weight during pregnancy, and breastfeeding also reduces in the reduction of weight after delivery. Because we also have long-term benefits to the mother. So, of course, where the main long-term benefit to the mother, of course, we have the spacing of the babies, because the mothers are able to space those babies, and the more space between one baby to the other, then you find the health of the mother is improved a lot, and also as well as her socio-economic status. Then, of course, the other long-term benefit is that because of breastfeeding reduces ovulation, or the number of times an egg will be released from the ovaries, then you find that this is protective against some cancers, including ovarian cancers, including cancers of the inner lining of the womb, called the endometrium. Yes.
Okay. So, does it also reduce the risk of breast cancer?
Of course, because this when women are breastfeeding, the main thing is that the endogenous estrogen, one of the hormones is that women produce when they ovulate, is progesterone. I mean estrogen on top of the progesterone. And we know that some cancers, especially for mothers of women who get cancers before they reach menopause, they are dependent also on endogenous estrogen. So when the endogenous estrogen is reduced for some time, especially during breastfeeding, then you reduce the risk of premenopausal breast cancers in women.
Okay, so we've mentioned the benefits to the mother. What about to the baby?
Well, the baby's benefits are also very many, and of course, we may not enumerate all of them at this time, but you look at breast milk as being a diet or a component that the baby takes that is made for the baby. So it is the right temperature, the right nutrition, at the right time, etc. Of course, there are different components of that of breast milk. And if you look at breast milk itself, you find about 80 to 88% is water. So for the baby, that water will satisfy any thirst that the baby has. Okay? Then you find that about 7% of breast milk is actually fat. And this fat, especially the initial long chain fatty acids, will act other than providing energy to the baby. You find that it also provides a way where the fast stools of the baby is removed, which is called meconium. Lipids are about 4%. 7% of breast milk is also carbohydrates, and carbohydrates will provide adequate energy for the baby. Then we also have about 1% which is made of proteins, which is adequate for the baby. Then we also have a lot of micronutrients, antibodies, and also white blood cells. So you find that for the baby, other than the nutritional value of the breast milk, it also allows for short-term and long-term protection of diseases. It also allows for growth of that baby, immediate and also long-term growth, both social and also intellectual growth. So you find that babies that have been breastfed, they get less diseases. You reduce their under 5 mortalities. They are also better educated because their intellectual capacity is also improved by breastfeeding. Yeah.
We're taking a short commercial break, but do stay with us and interact with our social media platforms, that is X and YouTube at KUTV Kenya. You can also find me across all social media platforms at Dr. Joy Bofenda. We're taking a short commercial break, but first, the Did You Know segment. Welcome back to Focus on Health. We are discussing breastfeeding alongside Professor Anthony Wanyoro. Take a look. Okay, so you've mentioned the components of milk, and there is this term called colostrum. What exactly is that?
Colostrum is actually the first few drops of milk, and the colostrum starts to be produced during the last, in majority of women, it starts to be produced during the last few days of pregnancy and within the first 3 days after delivery. It is yellowish because of some reason. It is very rich in anti-infective agents which protects the baby against infection. It is also very rich in growth hormones, which will allow the gut to mature. It is also rich in fatty acids or lipids, and that is what makes it yellow. So it allows the baby to evacuate the first stools, which are called meconium, which are very tenacious. It is also very rich in some vitamins, especially vitamin A, which will protect the baby's eyes against eye diseases. So it's a very important few drop milk. Yes.
Okay, so there's this practice in communities where colostrum is just drained to the soil to appease the ancestors or something like that. Would you also comment on that?
Of course, communities have had their own misconception about colostrum. But it is for us as medical people, from what I've said, that the colostrum is very, very important, and it gives some benefits that goes beyond even the childhood era. So it is for us to educate the communities and tell them that yes, colostrum is not supposed to be wasted. It's supposed to be fed to the baby because it has a lot of benefits to that baby.
Okay, so you've also mentioned a big component of breast milk being water, and we find that some mothers actually give water to the babies. Does this have any implication?
Well, from the components and from studies, we know that if you look at breast milk, the first 6 months of a baby's life, the baby does not need anything else other than the breast milk. So it will provide water, it will provide nutrition, it will provide anti-infectives for the first 6 months, 100%. It's only after 6 months to 1 year that you'll find that what the milk provides is about 50% of the child's need. And that's where now we start to introduce something else. Then after 1 year to the second year, so the mother's milk will produce about a third of what a child needs. So you find that, of course, you go on increasing the things that you need to feed the baby as the baby grows older. But in the first 6 months, and the WHO also says that we should exclusively breastfeed the baby without giving anything else. The milk will provide 100% nutrition and also fluids to reduce the thirst in that baby.
Okay, so you emphasized on the first 6 months. Does it mean the first completed 6 months of a child's life, or at the 6th month, that's when we start introducing complementary feeding?
From birth to 6 months, exclusive breastfeeding is adequate for the baby. It is only after 6 months, because you have said, especially the nutritional components will go down by about 50%. That if you don't introduce now other feeds, then the baby will run a risk of taking less and having malnutrition. If this goes beyond 1 year, again, you are still exclusively breastfeeding and you have reduced the nutritional value by about a third, then you run the risk of malnutrition. But if you are able to breastfeed exclusively within the first 6 months, then there is no risk of malnutrition in that baby.
So, Daktari, some women face a lot of issues during breastfeeding, including cracking of the nipples. Some get mastitis. Should they still continue breastfeeding when they have these issues?
Well, we know that there are some challenges that women get, and the challenges of breastfeeding. And the challenges could be because of the baby. If like the baby is not able to breastfeed for whatever condition, a baby that is sick, a baby that has congenital abnormalities, maybe in the mouth there is some deformities, then they are not able to feed. Of course, mothers face challenges mainly of using the wrong technique of breastfeeding, where you find the baby is not latching properly to the breast. Then if they get that, then of course they run the risk of getting some pathologies within the breast. The first one may be cracked nipples, which is very painful, as more as on the nipple itself. Then, of course, if this is ignored, then you find the mother may stop to breastfeed or not being able to completely get the milk out from the breast. Then they get breast engorgement, which is also another painful condition. Then if this is further ignored, the two are ignored, then you may get bacteria going within the breast tissue, leading to mastitis. Of course, if mastitis is also ignored, then a mother may also get pus formation within the breast, then which leads to a breast abscess. So when a mother gets cracked nipples, then or they get engorged breast, or they get mastitis, does not stop them from breastfeeding. So we encourage them to breastfeed, and they should also ensure that they empty the breast completely, okay, and that will help the breast to heal. Because if there is mastitis, you give also an antibiotic, and for the three conditions, you also give a pain reliever. Support the mother properly. It is only when a mother develops a breast abscess that you stop breastfeeding on the said breast where there is an abscess. But the opposite breast where there is no abscess, the mother continues to breastfeed. To avoid the breast that has an abscess from stopping to produce milk, then the mother, as they wait for the breast to heal, they are supposed to express that milk out, okay? But they will throw that milk away until the abscess heals completely.
Okay, so Dr. also, other challenges that women face is the lack of milk completely, not even during the delivery, maybe 3 months after, 6 months after. How should they mitigate this?
We say that one, breastfeeding and breast milk production is possible in a majority of mothers if they use the right technique. So the right technique to ensure that milk continues to flow in a mother who has breastfed is that the baby must be placed on the breast correctly. And the correct position is the baby's skin should touch the mother's skin. The umbilical stump of the baby should face the mother's abdomen. Okay, and then the mother should hold the baby close to the breast without bedding too much, so that the baby is brought to the breast. Is not the breast that is brought, not the breast that is taken to the baby, if you understand what I mean. Then the mouth of the baby should be completely open, and the baby should be able to latch on the areola, the dark part of the nipple area, and the nipple should be at the back of the breast, of the mouth. When that is done, what you notice is that the baby's chin will touch the breast, and then the cheeks will be full. Okay, then the baby will be able, you'll notice the baby breastfeeding and then suckling for a longer period, okay, than when the baby is not properly latched. So that way you find that the baby will be able to completely empty the breast. The other thing that ensures that milk continues to flow is the mother being able to breastfeed on demand. So every time the baby cries, or every time the baby starts to fret, then you put the baby to breast. The third thing is ensuring that there is complete emptying of the breast. Then the fourth thing is that during the breastfeeding, the baby should be put on the one breast and then on the other breast, okay, during the same episode of breastfeeding. Then, of course, the maternal nutrition is also very important, taking adequate fluids, and also the mother being supported properly, offered all the support, and having enough rest during the time that the mother is breastfeeding. So all that will ensure that enough milk is being produced in a mother.
Okay, and what is your opinion on using this canned milk for children, for babies?
Alternative sources of childhood nutrition are not advisable for several reasons. One, remember this canned milk is industrial produced. So it lacks a lot of things that a baby needs. So it doesn't have any living cells. It doesn't have any anti-infective agents. Then you look at the nutritional value is not as good as the milk that comes directly from the mother. It is also not in the right temperature, not having the right temperature. And finally, you find that this canned milk, the mother needs to reconstitute it. So the ways of reconstituting it, the water that is being used may also not be very good. So you find that because of all this, when mothers are using the canned milk, then the babies have a risk. One, they don't get the right nutrition. Two, they don't get the right protection against infection. Then three, there is a high risk of infection being introduced in the baby. And of course, the growth will be affected. The babies will have diarrhea. They will have pneumonias. The risk of under 5 deaths of your baby, of that baby, increases. So, and that's why we say that this milk should be avoided completely in a baby.
Okay, so you've also mentioned some babies having diarrhea, and it reminded me if you introduce complementary feeding early, does it cause the children to have problems such as gastritis?
So, yes, it does. And that is why exclusive breastfeeding for the first 6 months is advisable, because it will allow for the gut to mature properly, and also will allow for the other protective agents to protect the gut, so reducing the risk of allergies and inflammation within the gut. So when you give complementary feeding very early, then you increase the risk of inflammation within the gut. And that in itself will increase the risk of diarrhea and gastritis in these babies.
Okay, so Dr. kindly give us your parting shots in relation to breastfeeding.
Well, breastfeeding cannot be replaced for a baby. Breastfeeding cannot be replaced by anything else. And breastfeeding is very, very important for that baby, both nutrition, preventing infections, preventing deaths in those babies where they are under 5, preventing chronic conditions like diabetes and even some conditions like cancer of the blood in these babies. And of course, also the intellectual development of the babies. Of course, also we have also seen that breastfeeding is also very, very important in the mother, which provides prevention of things like bleeding after delivery, maintaining the weight of the baby, of the mother, okay, and also preventing some cancers in that mother. So it is good for every mother to ensure that they adequately breastfeed that baby exclusively for the first 6 months, and also to continue breastfeeding the baby even after introducing other feeds for at least 2 years after the delivery of that baby.
Okay, so thank you so much, Dr. That was very informative. We hope to have you again soon.
You're welcome. Thank you.
A very interesting conversation we've had alongside Professor Anthony Wanyoro, and just as he has emphasized, nothing can replace breast milk. Find us on our social media platforms at KUTV Kenya on X, YouTube, and Instagram. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy. I'll leave with the Healthy You segment.